Thank you for having me here. Good morning, ladies and gentlemen. Okay, this is next. Yeah? All right, so this is forward. Yeah, wonderful. Thank you. Well, good morning, ladies and gentlemen. The topic of my today's presentation is basically about the mitochondrial function, about the mitochondria and how we can address to that. But I believe that a short brief introduction and a brief disclosure due so that I can explain my point to you in a more effective way. You see, the first 16 years of my medical career as a doctor and a surgeon, I, together with my colleagues from the medical establishment, were in a business of treating conditions, different medical conditions. And needless to say that I consider myself quite a savvy person and critic and skeptic, quite fast have developed a certain level of dissatisfaction with generally with the outcomes that we as a establishment of conventional medical community will produce to our patients, because yeah, indeed we quite succeeded in treating conditions, but if you look at the quality of life and the well-being, the wellness of the patients, it was those who were discharged from our treatment or discharged from the follow-up, very often it was quite far to be called ideal or optimal. So about 10 years ago, for the past decade, I have decided to change my approach towards the management towards the nature of the business, you know. And from treating the conditions, I decided to move towards treating patients. And lucky was I, in 2013, the first publication about the so-called hallmarks of aging, or the drivers of aging, which are also the drivers of the practically all chronic age-related medical conditions, came out, and we all know them. It's 7 of them. It's mostly the impaired adaptation to stress, impaired proteostasis, macromolecular damage, mitochondrial dysfunction, epigenetic shifts, exhaustion of the stem cell pool, endogenous stem cells in the body, and so on and so forth. It is all well described in the literature for the past 10 years, and it's been discussed practically on all conferences in regenerative anti-aging medicine. So I do believe, of course, in that, and I do use that widely in my practice. And what I have done for myself, I've developed a specific approach towards management of the well-being or the wellness, overall lifespan and health span of my patients by creating sort of like, or approaching, addressing to the 3 pillars of well-being. And those 3 pillars are, the first one is the metabolic health of the patients. That includes the metabolism of the major macromolecules and of course the micronutrients as well in the body, including the energy metabolism, the energy production in the cell, in the tissue, and the energy utilization. The second pillar would be the immune health, because immune system is protecting our body from antigens, it's protecting our body from the cancer cells on a daily basis and practically minute after minute, as well as protection from the autoimmune conditions. By the way, the first pillar was somewhat described in this book, that it's a collaboration with the European Society of Preventive Anti-Aging and Regenerative Medicine, and the main understanding about the immune system we have described in this book that we have released earlier this year. Because for many doctors, unfortunately, until now, immune system is something very non-tangible, it's something immaterial, you know, so we have tried to make it as simple as possible in this book, with all the practical recommendations about what can be done to improve the immune health in the patients. And the third pillar is the hormonal health, because the hormones, and I have to say that all these 3 pillars, they're not separate, they're not distinctly divided one from each other. They're very, very much interrelated, because if we take the hormonal health, certain hormones are involved in metabolism. Certain hormones are anabolic, certain hormones are catabolic. For instance, the insulin is a classical example of the anabolic hormone, or growth hormone, which is mostly addressing to it is indeed the anabolic, but it's mostly addressing to the energy metabolism because it is responsible for the redistribution of the energy in different types of the cells. So with approaching these three pillars of wellness or the well-being in the patient, we believe that we can more or less successfully increase the lifespan and the health span of the patient. And from just being a doctor or a healthcare provider, you can become sort of like a companion or a partner to your patient, that you can just go along the journey lifelong for that patient. And the topic of the mitochondrial medicine is very, very, very much related to that. When this presentation was done just a couple of weeks ago, literally about like 10 days ago, I was watching a lecture of Professor Robert Lustig, who I'm a great fan of his work, and I was particularly attracted to this slide when he called it the hateful eight, or the subcellular pathologies that drive all chronic diseases, and he was talking about the glycation, oxidative stress. So when I saw this slide, I just realized that the topic of my today's presentation is directly related to the oxidative stress, mitochondrial function, insulin resistance, autophagy, inflammation, and membrane instability. So 6 out of 8, so I decided to include this slide instead of the prologue. The only thing that I practically agree on every point that Robert Lustig is making in his lectures. The only thing that I slightly disagree, you see, he said that all of these conditions can be only addressed with the dieting. You can out-diet it, but there are no possible pharmacological interventions that can improve that. I agree with him on this. However, we as doctors of the 21st century, it's 2023 outside, and as a people who are practicing regenerative longevity medicine, anti-aging medicine, we do not use only the pharmaceutical approach. We use cell therapy, stem cells. We create and we promote technologies from the regenerative medicine that are capable of disabling the triggers of the disease and harnessing the endogenous regenerative capacity. And when I was a medical student, when I was an undergrad, and I believe I'm not the only one in this room, I believe almost everyone, the most hated subject that I had was biochemistry. And I really hated biochemistry. When I became a doctor, and the more I practiced, the more I loved biochemistry. So now I believe that the biochemistry is like the number one. And the way how I address to my patients now is basically I look at them as, I approach to them as to the open dynamic biological system. And when I'm looking at the blood work, when I'm looking at the biomarkers, I'm actually imagining that the entire terrain, it's like a schematic description of the entire biochemistry textbook, that I just create in my imagination, and I'm just thinking where is the disruption, how I can address to that, and how I can improve that. And another thing that I just realized that any living cell, any living organism, tissue, organ, and of course the organism as a whole can exist only in either catabolic state or anabolic state at a specific period of time. And if we pursue the target of longevity, perhaps, and we call ourselves the anti-aging doctors, then we should focus on the catabolic processes, so we're supposed to stimulate the AMPK and the rest, because that is sort of the longevity gene, right? With all the cascade and the consequences that it will trigger, the autophagy, glycolysis, the mitochondrial biogenesis, and so on and so forth. However, if we want to call ourselves regenerative medicine doctors, then we have to understand that we have to put the patient in the anabolic state, because when the person is, or cell, or tissue, or the body as a whole is in the catabolic state, it cannot regenerate itself, because regeneration means creation of new molecules. new macromolecules, and that is definitely the anabolic pathway, and that is regulated via the mTOR gene. So the cycling of the catabolic state and the anabolic state that we should put our patients into, I believe, is the essential in the modern contemporary practice of holistic genetic molecular precision personalized medicine, which all in general can be called as regenerative medicine. And whether person, the organism, is an open biological, dynamic biological system, or the cell, whether it's in a catabolic state or the anabolic state, the mitochondrial function is ultimately involved in it and plays a crucial role in it. So what is mitochondria? Of course, from the point of evolutionary biology, we know that mitochondria is a parasite that turned into the saprophyte. It's a cell that lives within the cell. We call it the power plant, yeah, because it's involved in energy production. Indeed, the glycolysis with generation of the oxidized NAD, which produces quite, I would say, a minimum yield of the energy. The ATP is just 2 ATP molecules. And then the entire Krebs cycle that produce additional, if I'm not mistaken, 24 ATP molecules, and the end process of that, you know, the breakdown of the macronutrients into the water and basically the thin air, the oxidative phosphorylation. It all is happening inside the mitochondria. In case if the patient or the cell or the person is completely in a catabolic state and it's fasting, it's conserving energy, and it's sort of using the accumulated molecules as a nutrition. We call it the fatty acid oxidation. Mostly it happens during the fasting state. It also happens inside the mitochondria. But then the anabolic process is the gluconeogenesis inside mitochondria. Calcium metabolism, where exactly inside the cell the calcium is metabolized. It's inside the mitochondria, as well as most of the lipids, amino acids. The signaling between the mitochondria and other organelles, between one cell and the neighboring cell, between this cell and the cell somewhere in a distant tissue, in a distant organ. The signals are mostly generated in the mitochondria. The hem synthesis, hemoglobin, the hem is synthesized in the mitochondria. And of course the steroid hormones. You know, where is the pregnenolone, cortisol, DHEA, testosterone? Where is it coming from? It's coming from the mitochondria. And with that, mitochondria is capable of regulating the cell cycle, cell proliferation, and as well as the cell programmed death, the apoptosis. It is an organ that generates reactive oxygen species. It's essentially creating the damaging factors for the cell, and in the same time it is triggering and launching the cascade of the protective measures against those generated ROS, reactive oxygen species. It is also very much involved in the regulation of the epigenetic status via the regulation of the sirtuins, you know, and as we know, thanks to the work of the Steve Horvath and David Sinclair, the epigenetic status is perhaps one of the main things that defines our biological age. The production of alpha-ketoglutarate, which the substance that's supposed to maintain endogenous, the viability of the endogenous stem cells, is also produced inside the mitochondria. The cytochrome C, cardiolipin, essential metabolic enzymes. Production of the transcription factors that will regulate which exactly gene has been transcripted. And then the activation of the sirtuins, NFKB, AMPK, and so on and so forth, again, is generated inside the mitochondria. With that, mitochondria is capable of regulating the immune system. It regulates the inflammatory responses, the chronic systemic low-grade inflammation, which is one of the hallmarks of the major, practically all diseases of aging. Regulates proteostasis, which is also one of the hallmarks of aging. Regulates adaptive stress responses. Direct impact on the hallmarks of aging. Regulates cell cycle apoptosis. It has a cytoprotective and metaboloprotective properties, and neuroprotection, whether neuroprotection in age-related neurodegenerative disorders or in the neurodevelopmental disorders, because it turns out that if we take a general population, the occurrence of mitochondrial disorders is somewhere around 0.002%, global population. But if we take individuals with who are on the autism spectrum disorders, it is as high as 20%. What happens if mitochondria is not ideal, if it's not optimal, if it's a bit dysfunctional? First of all, accelerated aging. Yeah, the body, the organism, the cell and the organism is aging faster than it should. Then the development of various neurological disorders, specifically neurodegenerative disorders. We're going to talk about it today. Insulin resistance and diabetes. I personally believe that insulin resistance is it's a major factor, damaging factor that we are yet to find out what are other diseases that are also triggered and promoted via the insulin resistance, so I believe we're just scratching the iceberg. Obesity, endothelial dysfunction, any chronic inflammatory conditions, CKD, cancers. In one of my earlier lectures about the mitochondrial medicine, I was specifically dedicating about 10 minutes to discussion of the mitochondrial aberrations and ablations in the mitochondrial DNA, which occur in different cancers. Nowadays, they're trying even to develop specific biomarkers for the prostate and thyroid cancers, specifically based on the mitochondrial DNA aberrations, which it turns out happens in some forms of cancer in 100% of cases. Macular degeneration, and by the way, David Sinclair's lab in Howard University, they're developing this approach, that they can reverse the macular degeneration, directly addressing that mitochondrial dysfunction in the retina. Hormonal imbalance, of course, because all steroid hormones are produced inside the mitochondria, and interestingly, that the locally generated mitochondrial dysfunction produces systemic effects. It has the distant paracrine, endocrine effects on other tissues and organs in our body. So, what is the role of the mitochondrial peptides in anti-aging and longevity medicine? Well, first of all, it's a lifespan extension. Yeah? So it's a reduction of the biological age. It's an improvement of the physical activity. So basically, the patients in whom you can improve the mitochondrial function or receive the mitochondrial peptides, they even improve the basic functional evaluation, like the 6-minute walk, they can meet the METS criteria better, on the treadmill and so on and so forth. They improve their motor function, they improve their insulin sensitivity. Interestingly, that it also causes the reduction of the pro-inflammatory factors such as the interleukin-1 alpha and interleukin-6, and it upregulates the anti-inflammatory factors such as interleukin-10, and it also has a direct impact on the metabolism of the fat tissue, especially not the subcutaneous fat, but the like the intracorporeal, the deeper lying, the fat that is inside the peritoneal cavity. So it biological age reversal, the performance enhancement, and improved physical status, physical activity status, better metabolic health, and anti-immunosenescence and anti-inflammation effects. And that's how the mitochondria looks like. Just a brief refreshment of the memory. It's the same type of the biphospholipid membrane, external membrane, internal membrane that creates those crista, where all those, and that the higher the density of the crista, the more active mitochondria is in its function. For instance, if you compare the mitochondrion from the hepatocytes and the mitochondrion from the skeletal muscle or the heart muscle, you will see that the density of the crista and also the amount, the quantity of the mitochondria is tremendously different, because the heart muscle is one of the most hard-working cells in the body, from the 15th, 16th week until the moment when the anesthetist decides to switch off the ventilator and declare death. So mitochondrial-derived peptides, surprisingly, they also have organo and tissue specificity. By the way, the mitochondrial matrix contains about 1,500 mitochondrial peptides, ribosomes, 13 essential mitochondrial peptides, which are present only inside the mitochondria. They're absolutely crucial for the survival of the cell second after second. Also, plus the humanin and 6 fractions of the small humanin-like peptides. Mammalian mitochondrial DNA is totally different from the somatic cell DNA. It has 16,000 plus pairs of nucleotides, and it has its own specific RNAs. Interestingly, that empirically, for the past 30-35 years, doctors have been approaching this mitochondrial function. For instance, Saitoro used they studied the effect of the cell extracts from the liver, lung, thyroid on their patients, and they've seen the 59% decrease of transaminases, 50 subjects with thyroid pathology who had low initial T4 levels, 76% have improvement of that. Lin used the thymic extracts, and it turned out that it stimulates the production maturation of the T cells, restores cell immunity in secondary immunodeficiencies. Wilson has published an article about the anti-aging effects of the liquid thymic extracts. Then Cazzola used the thymic extracts in atopic dermatitis, chronic bronchitis, and various infections, and they've observed, as well as the rheumatoid arthritis, the autoimmune conditions, and they observed and documented the improved status of the immune system. Liver cell extracts are found to improve tissue regeneration, liver tissue regeneration, fatty acid metabolism, which of course we know, de novo LDL production and all in liver that happens due to the defects in the function of the coacetyl A, and the carbohydrate metabolism. The further the hypothalamic peptides, they regulated production of the wide range of hormones, including the thyroxine. Pancreatic peptides enhance the production of the pancreatic enzymes, and we're gonna later in the very end I will show you some very new data about it. Then in 1996 already Kumar has established that the chromogranin A contains in abundance of the xenogenic adrenal extracts to demonstrate anti-stress properties and improves the steroid synthesis in adrenal glands. So it's a direct hormonal modulation. Interestingly, the Dr. Pruden, the father of the cartilage therapy, he showed the efficacy up to 80% reduction of the 75% reduction, 75% reduction of the pain, and up to 80% improvement in terms of the cartilage regeneration with administration, intra-articular and per-articular administration of the cartilage extracts to the patients with osteoarthritis. By the way, last year we have published an article, a paper, about the role of the mitochondrial dysfunction in the cartilage in the patients with age-related osteoarthritis. It's available online, or you can visit our website, the article is there, and so on and so forth. Interestingly, that exactly 20 years ago, in the year 2003, Stellar Biomolecular Researchers formulated nanopeptides, which also have a very small fraction, about 2% of the mitochondrial peptides there. And then, how did the science develop after that? 2004 and 2005 is the first paper that is coming from Germany, from the Köln University, from the Institute of Molecular Medicine, and it's titled Characterization of Peptides Released from Mitochondria. At that moment, now of course we know that it's about 1,500 different mitochondrial peptides, but in the year 2004 they were able to identify 270 different peptides. They even specifically localized them, they established their location inside the mitochondria. 40% of them were in the inner membrane and 46 were in the matrix. And they have also tried to study their gene ontology, what exactly is the function of those peptides, and they found that mostly those proteins were related to the respiratory chain. And We have 20 years past, now we know that mitochondria-derived peptides promote metabolic homeostasis, reduce insulin resistance, reduce obesity. It has direct anti-aging effect. It has very much related to the chronic stress, energy metabolism, and reduces the senescent phenotype of the cells. There's tons of articles available online. We also have a new branch of medicine which is called mitochondrial medicine, which was essentially started in 1969 when these two gentlemen, independently, one from each other, at the same time had encountered two patients with absolutely same pathology. It was later it was called as a Luft syndrome, although Lars Ernst was the first one who met such patient, was a patient with a myopathy. And now we even have the MitoMap, which each one of us can contribute as long as we establish certain things. We need to find and prove the defect in which particular loci of the mitochondrial DNA is happening, which protein or peptide, mitochondrial peptide, is going to be impaired due to that defect in the mitochondrial DNA, and you need to describe the clinical phenotype. And if you prove these three things, you can have a new disease with your own name on it. So, what do we know so far about the mitochondrial-derived peptides? Because some of them are famous, some of them are very famous, several celebrities, I would say, and some of them are hardly known. So, who is the celebrity? Well, of course, the humanin, and it is known to be to have the potent immunoprotective effect, specifically antagonizing against the Alzheimer's disease and the amyloid beta protein. And of course we do know now that the beta amyloid has got nothing to do with the occurrence. Yeah, it's not the cause of the Alzheimer's, but it's one of the factors that make it a bit difficult to treat. A small humanin-like peptides, they have potent cytoprotective role, and specifically fractions 2 and 3 are involved in the insulin synthesis and the insulin sensitivity. And also it is known to increase the level of leptin directly, which is a factor or the hormone which is improving insulin sensitivity. What else do we know about the mitochondrial peptides? How do they work, you know, the pathways? They improve or they promote the cholesterol translocation from outside, from the cell cytosol inside the mitochondria, and they trigger, they activate the mitochondrial cholesterol side chain cleavage. What it means that the cholesterol, which is the starting point from which the pregnenolone is produced, and further the cortisol and the DHA and all 48 steroid hormones, and basically that's all are the derivatives, the metabolites of the cholesterol, so it's happening there. The import of the proteins from the cell inside the mitochondria. The mitochondrial peptides is a very strong anticoagulant function, so basically they save lives and help us not to die from the acute cardiac events. They also directly modulate alpha-synuclein, and the malfunction of this process is related to the Parkinson's disease, and they selectively bind to the cardiolipin and modulate the interaction with cytochromes. You know, cannot be more essential than that. I can hardly think of any other intracellular enzymes or intracellular proteins that have more significance, bigger significance than mitochondrial peptides. This basically, this slide shows the main steps of how the mitochondrial peptides are produced. You know, it's similar to other production of naturally occurring peptides and conversion them into the ready-made biological product, which is ready and used for the clinical application. It's the comparison between the nanopeptides on the left, and as you can see, mostly the molecular weight is below 10 kilodalton. It's from 3 to 6 kilodalton. And the mitochondrial peptides of different origin on the right, and molecular weight is slightly high. It's somewhere in the range of 45 to 65 kilodalton. We have further collaborated with other independent institutions like this one, for instance, University of California, Irvine, and we have published the paper. We have done the matrix-assisted laser desorption ionizing time of flight, so MELD-TOF mass spectrometry. And the purpose of that was to identify and group the peptides and try to sort of characterize them, you know, to give a tag, you know, to put a tag on them, basically. We also established that the stable concentration in all products is between 250 to 260 microgram per milliliter. And it turns out that the peptides can be grouped into the 6 major groups according to their molecular weight. Of course, there are some peptides which are even the 6 or 14, 20 kilodalton, but the majority are in the range of 45 to 65 kilodalton. It means that the bioavailability is quite high. It's not extremely heavy molecule that will be difficult to carry, difficult to relocate in the cell. We have continued further investigation of what is exactly, because everyone here works with the exosomes, everyone here works with the stem cells, you know, and if you ask yourself, like, what is the actual active ingredient inside that vial that you're given, and you're saying, yeah, I'm giving like 1 million of exosomes, or billion of exosomes, or trillion of exosomes, or 10 trillions, or gazillions of exosomes, but what are you giving to patient? What is working inside the patient? Don't know. So we try to find out, and now we know. Because we have done the gene ontology in Heidelberg University in Germany. Gene ontology annotation is the information about the function of the gene and its product, so specifically the protein. And the annotations are described in specific terms, which are called the molecular function, cellular component, and the biological process. So basically, we can say that we have done the mapping of the metabolic terrain of the entire organism, and we've directly identified what are the actual components of the product, the medicinal product, the product of the biological medicine, what molecular activities it does as the peptide, where exactly it is supposed to be located in the cell, and what are the pathways and generally what are the biological processes that these particular peptides are involved in. What we have found out that basically we're talking about from 150 to 200, thank you, of peptides from different organ-specific solutions. For instance, the mitochondrial peptides, which are extracted from the lung tissue, they have significant geoterms which are involved in the glutathione metabolic process, removal of oxidants, cellular detoxification. Specifically, it contains such substances as annexin 1A, which has a high expression in lung macrophages, azurin and lenexin, which have high expression in the terminal bronchi. The mitochondrial peptides, we have run the tests on the toxicity with the human stem cells and embryonic cells. It turned out to have a zero toxicity on human cells, but it turns out that it actually prevented the senescence of the cells in the culture, and also it has prevented the senescence of the stem cells in the culture. And we have done the mapping using the Mitocarta trio and the Biomart. You know, it's something like the atlas of peptides and proteins. And we also established that there is no DNA contaminants there. Although these are the mitochondrial peptides, but they still show quite a significant organ and tissue specificity. And this chart is a comparison between the cell extracts from different type of the cells. It shows that yes, there is a certain amount of the peptides that are overlapping all across the product. So they're present in all different organ-specific or tissue-specific products, but in the same time, there's a significant number of peptides that are absolutely 100% tissue organ specific. Then we try to understand and identify and characterize specific molecules which are pertinent to the mitochondrial function. Turns out that those are the aldehyde dehydrogenase, superoxide dismutase, adenylate kinase, stress 70 protein. And this is just a brief information. It's, as I said, we're talking about close to 200 different vital, crucial enzymes. Further, we have assessed its relevance towards the oxidative stress. And it shows that here, practically all different organ-specific peptides, they show practically the same outcome. So they all have a very strong presence, significant presence of enzymes which are relevant to the response to the oxidative stress, irrelevant of the type of the tissue. Well, not bad. When we have run the gene ontology analysis, which is related overall to the cellular metabolism and different metabolic pathways, here we have found a tremendous discrepancy, tremendous organ specificity. So I tried to just summarize some of them. We have this particular type of peptides. It's a combination of, initially was 7, now 9 different organ-specific peptides, which we use clinically for the metabolic syndrome. And it turns out they're mostly related to the activation of autophagy, stimulation of mitochondrial biogenesis, mitochondrial gene transcription, regulation of the fatty acids and insulin sensitivity and increase of the glucose uptake. Now it starts making sense. Why? The main indication for this formulation is metabolic syndrome, diabetes type 1, diabetes type 2, even gestational diabetes. You know, we've seen patients with gestational diabetes who respond within a week, you know, to these peptides. And the protocol of treatment, usually we do it as a consequence after the stem cell treatment. It's only 2 or 3 vials intramuscular per week, and duration matters. We're talking at least 10 to 15 weeks and this protocol can be repeated twice a year. What do we see as an outcome? As an outcome, basically we see the reduction of the insulin resistance. Mostly what I see is the reduction of the serum insulin level. Yeah, so it has more like a normal spikes and troughs sort of a pattern, and improvement of the glucose and the lipid metabolism. The mitochondrial peptides, which are naturally occurring in the cardiac myocytes, again, thanks to the research which is done in Japan and for the past less than 10 years, 5-6 years, and they've established that the major factor that will predict survival of the patients with cardiomyopathy is the level of the protein aggregation. In other words, it's how bad the autophagy in the cardiac myocyte is impaired and how much of a giant protein, cross-linked protein, is accumulated within the cardiac myocyte. That will determine whether the patient is going to survive within 5 years or is going to die. Because the impaired protein quality control leads to misfolded protein aggregates, cellular death, damaged mitochondria. It's like a vicious cycle. Cardiac hypertrophy and cardiac tissue remodeling. It turns out that mitochondrial peptides naturally occurring in the naive cardiomyocytes, they involved in activation of the autophagy and antioxidative stress protection. They also stimulate mitochondrial biogenesis, and they significantly express related to the glycolytic process and oxidoreductase activity. We use them in all forms of cardiomyopathy, patients with ischemic heart disease, as well as the pre- and post-operative care for the patients who go in, even for the open heart surgery. We combine them actively with the coenzyme Q10, high-dose co-carboxylase, meldonium, hexarelin, stem cell therapy, AASCP, HBOT, and so on and so forth. And as an outcome, thank you. Just a few minutes left, thank you. And as an outcome, we see very rapid increase of the ejection fraction and overall cardiac function. Clinically, phenotypically, it's a disappearance of cyanosis, it's a much better physical activity in patients, reduction of shortness of breath, peripheral edema, and so on and so forth. CNS, the neuropeptides, so the mitochondrial neuropeptides. When it's coming to the age-related neurodegenerative disorders, and specifically Alzheimer's, well, now we understand that the triggering factor is not the accumulation of the protein. The triggering factor is actually the imbalance or disruption in the energy metabolism. So it's an inability, it's a downregulation of the insulin receptors in the neurons and inability to effectively absorb and utilize glucose. So we found out that there is a significant presence of the nucleoside diphosphate kinase. It's an enzyme that catalyzes the transfer of the alpha phosphate between the triphosphates, the ATP-ADP, so energy production. And it also stimulates and modulates the Krebs cycle inside the neural cells. And it also is very much related to glycolytic process and increase the activity of the alcohol dehydrogenase, plus promoters of the insulin sensitivity and glucose uptake. It is clinically used both in neurodegenerative disorders of old age and also in neurodevelopmental disorders in the autistic kids, kids with various genetic abnormalities that cause learning disability and disability of the cognitive function. We also use that in the stroke patients, and in stroke patients as soon as possible after the acute event, and it can be given on a daily basis, daily up to straight for 1 month, and it shows no toxicity, tremendously faster improved recovery from the neurological deficit after stroke. It is also can be combined and is usually combined with neurotransmitters, precursors of the neurotransmitters, and with other xenogenic medicinal products such as cerebralizine. We use that together with transcranial therapy, hyperbaric oxygenation, and theta chamber. We do it in a clinical setting in our clinics. Last but not the least, generally for the anti-aging male and female rejuvenation, now we even have the improved formulation. It's 12 different organ-specific peptides in one vial. A few years ago, we have done a study when we took the volunteers with 17 patients with chronic age-related degenerative disorders, diabetes, hypercholesterolemia, cardiomyopathy, osteoarthritis, even the cataract. We showed that most of the patients clinically showed a very good response. There were no allergic reactions. We managed even to reduce the dosage of certain medications that patients were on. But most interestingly, we have done before and after analysis of the certain the expression, the assay of some of the mitochondrial peptides before and after treatment. And also, we assess the oxidative stress and the antioxidative protection. We found out the humanin and the small humanin-like peptides, which are depressed by about 40–50% before the treatment, have practically returned back to the norm. For instance, the humanin level increased from 123 to 206 picogram per milliliter. We found out that the reduced glutathione increased by 32.6% post-treatment. No glutathione was used during the treatment, only the mitochondrial peptide, so it was the endogenous stimulation. We have run the superoxide dismutase, which is the manganese-containing superoxide dismutase, which is responsible for the inactivation of the superoxide ions. We have found out that statistically a significant increase of the serum level in the SOD, and it's superoxide dismutase 2 is a specifically mitochondrial enzyme, and also we have seen that other markers of inflammation such as the ESR, CRP, and ferritin has tremendously reduced when we didn't do anything specifically for that except we gave these mitochondrial peptides. Catalase, which is the major enzyme which is involved in the cellular redox homeostasis, and it inactivates the hydrogen peroxide molecule. It is tremendously involved in the diabetes type 1, type 2, and specifically in the development of the complications of the diabetes, such as retinopathy, angiopathy, and so on and so forth. It also is directly linked to the Alzheimer's disease because it binds to the amyloid beta and leads to the decreased enzyme activity. And we have seen that just with the neuropeptides, we increase the activity of this peptide. It also has direct effect on the patients with Parkinson's disease because in Parkinson's disease, the alpha-synuclein causes leakage of the dopamine from the cell, and thus the dopamine just escapes the systemic pathway. And lastly, and I'm done with this, we have collaborated again with University of California, Irvine. There's a paper published end of last year, about the protective effects of stem cell-derived peptides in preventing of autoimmune diabetes in non-diabetic mouse model, when we took a classical standard model of the induced diabetes in mice. We have scaled down the human dose of the mitochondrial peptides, which are extracted from the pancreatic cells, to the body weight of the mouse. It was administered twice a week in a span of 17 weeks. Blood glucose measurements were done, and also the cytokine panel was done. What have we seen after 17 weeks? A 33% greater non-diabetic population in MO-treated mice versus the saline-treated mice by the end of the 17th week, 33% less. We have run the test for the erythropoietin also, because erythropoietin, especially in the fetal development, it exerts anti-apoptotic, proliferative, anti-inflammatory effects specifically on the islets of pancreas, and it promotes the formation of the islet cells and the expression of the insulin. And we have seen a 90% increase of the erythropoietin in the MO-treated mice. Now we understand why 33% less non-diabetic mice. And also, even in those mice who still develop diabetes, in all of them was statistically less glycemic level throughout the 17 weeks than in the control group. So that's all that I have to say, ladies and gentlemen. Basically, we have the power plant, so if we want that power plant to supply cells of our patients and the bodies of our patients with energy as long as possible, we have to do something to perform a regular maintenance of that power plant. So thank you very much. You can visit our booth and our website. All the publications, all the articles are there, as well as the testimonials. And it's all open on our website. And stay healthy, be alive, have fun, and most importantly, please remember that neither you nor your patients don't have to get old and deteriorate as we age. Thank you very much.